Good afternoon. Health Minister Dr Zweli Mkhize has launched phase 2 of the COVID-19 vaccine rollout campaign in KwaZulu-Natal at the Royal Agricultural Showgrounds in Pietermaritzburg. Nearly 150,000 people older than 60 have so far registered to be vaccinated in the province. The vaccination of healthcare workers is also continuing. Now, the Provincial Health Department is urging those who are eligible to register on the Electronic Vaccination Data System. The Minister addressed the media a short while ago.
We are hoping that on this second phase, we're looking at 16 million people to be vaccinated. In this process, we'll be able to do the first and second dose. We want our people to be very patient because we might want to delay the second dose by up to 3 months. We are looking at that. And if that happens, don't feel aggrieved. We want to make sure we reach as many people as possible and then build up the immunity, because the evidence coming from the UK has shown that there's better immunity developing if someone gets a second booster dose, a second dose after 3 months than if you do that after 3 weeks. So there's no challenge as such if we're to delay. This is to make sure that we reach as many people as possible. So we'll confirm that with time. Yesterday when we started, we had experienced a number of challenges. Among the challenges that we have experienced was that the load shedding created a challenge with the Electronic Vaccination Data System. It did not affect the cold chain because we have already prepared alternative and contingency arrangements so that there is no chance that the cold chain can be broken. So the load shedding then disabled the system and made the reception a bit slow, and the fact that we had to use a lot of manual records for that, but nevertheless it does not derail our electronic vaccination system. So yesterday on the electronic vaccination system, we recorded more than 11,000 people, but then of course we still are waiting for reconciliation, which will happen when all the manually calculated numbers are reconciled. So that for me is an area that we're going to be working on to correct so that it doesn't affect us so badly in the future. The second issue we found was a bit of a disturbance. Some of the areas were disrupted by protests, such as in Bloemfontein, where they had to close down the site. And so we hope that alternatives will be worked on so that people can continue to vaccinate despite the protest.
Right, let's get more on the story. We're across to our reporter, Jay Lee Paulser. Very good afternoon to you, Jay. There's been some angst about this vaccination process. Some people complaining about the slow pace, not getting SMSs about being vaccinated, and now load shedding. Tell us what's happening on your side.
Well, that's very true, and these are some of the questions that we posed to the Health Minister Zweli Mkhize during that media briefing, asking him, even the online registering, will that actually help in the rural areas? Will they be able to access that? And he responded to my question saying that we must remember that online registering system is just to register you as a person to be vaccinated. It doesn't necessarily mean you can't go to any healthcare clinic or hospital that will be available during phase 2 of the rollout across the province and across rural provinces. And I said to him that, KwaZulu-Natal is predominantly rural. We have Zululand here, which we see a lot of people needing healthcare facilities. And with COVID-19 in the mix, this is obviously going to add to, that strain that they are feeling already in the Zululand area. And he said to me that, no, they will definitely have people on the ground going to the homesteads, going to the people in the rural areas to make sure that they are registered. And just looking at some of the facts, if you can just bear with me, it's a lot of information to get through. Speaking to the MEC, Nomagugu Simelane Zulu, she said they are looking at 250,000 people a day that they would like to vaccinate. From now until June, they're looking at 6 million vaccines, 2P concluded. hoping to vaccinate 16 million people in the province in a couple of months. And then looking at the challenges, obviously that load shedding problem that the minister spoke about, the electronic vaccinating system being disabled and the system making it very slow, and saying that they had to go back to the drawing board and do it manually. And these are some of the issues that they are finding. The cold chain interruptions as well are a main concern for the Department of Health. And they're also looking at ensuring that healthcare workers are also on time. And just alluding to the fact that he was saying that, many of the healthcare workers now have been vaccinated. There's about 60,000 healthcare workers in KwaZulu-Natal province that will be vaccinated by the end of this week. We heard the MEC coming out strongly there, saying that during phase 2, they want to ensure that in KZN, all healthcare workers are vaccinated, and then looking at phase 2, which deals with the elderly, the senior citizens, making sure that a number of them are also vaccinated. And, just going back to the rural issue at hand, I think a lot of people are wondering, is this going to be able to be rolled out in those areas? And as much as people have been hearing about vaccinations and where they should go to and the different types of establishments that will be erected, there's still a lot of concern in the province. If we look at the province as a whole, we saw the MEC saying 680 vaccination sites in the province, which include community halls, and 27 of those will be in the healthcare sector, the healthcare sites, and then looking at 1,600 healthcare workers and teams that will be on the ground and facilitating all of these sites. So still a lot of work to do in the province, but the Department of Health in KwaZulu-Natal, as well as the MEC, Nomagugu Simelane Zulu, and the Minister coming out very positive, saying that they are happy with the work that was done. Obviously, there were challenges with the rollout yesterday in some of the sites, such as the Bloemfontein site, where there were protests. But the Minister said that overall, it has been a successful rollout of phase 2 thus far. I'm just going to step out of shot and show you some of the healthcare workers on the screen, as well as the senior citizens that are still coming to vaccinate. Obviously, predominantly, most of these are nurses and doctors from the various 10 districts here in KwaZulu-Natal who are going to be vaccinated. And we've been seeing them flocking in with buses, minibuses and cars to come and vaccinate. And obviously they will be concluding the drive of the healthcare workers on Friday, saying that they are hoping to finish the vaccinations of all the healthcare workers, but then they will continue with the senior citizens and elderly, looking at old age homes, going to various communities and visiting the frail.
Jadely Pauser, thanks for that update from KwaZulu-Natal. Health Minister Dr Zweli Mkhize going there to start that phase 2 of the vaccine rollout, and we will keep you updated on what's happening there.